talking about. But first, let's start by saying what is the wrong way to get the idea. And some of you would have seen this situation. I think we should do a research on bleeding gums. I think we have got a new drug, linezolid. Let's do a research on linezolid. That is not the way to do research, right? Here's a, here's a setting. Somebody says, we have a new PCR machine. Let's do a study using the machine or review cases. We have lots of cases of intestinal obstruction. Let's review our cases. Or, I'm really interested in diabetes. Let's do a study on diabetes. I'm interested in this particular or that particular subject. Or, we know the side effects of penicillin in North India, but nobody's published a study from South India. Let's do a study from South India. And this is not the way to do a research. What's happened is that you are saying, let us do a research or let's do a study on this topic. That is your idea. That's a wrong idea. What you should be doing is, the right way of doing research is start with a question. And this is what I was mentioning. You're walking around, you're talking around, you're taking around, you're chatting with people, and a question arises. Be very, very aware a question has arisen for which we did not have the answer immediately. Write it down, note it down, and then look up the literature. If the literature does not answer the questions, that is the idea for research. To give you some examples of ideas for research. So you have, just a second. I'm not in presentation mode, no? So, like from a disagreement, you say something and somebody else says something, and Priyanka says something, and Mona Lisa says something, and you disagree. That's a good setting for a research. Or you're challenging existing practice. We've been giving chloroquine for COVID. We've been giving chloroquine for COVID. Everyone is giving chloroquine for COVID. Is it really correct? Let's challenge it. So you have an existing practice, read about it, satisfy yourself that the grounds for the existing practice or policy is not correct, and sure, you can do a study. Sometimes I mentioned just now that if a study has been done in North India, you don't have to do it in South India. But suppose you say that, look, in North India, let's say the prevalence of diabetes is much higher than in South India. What applies to North India does not apply to South India. Then by all means do it. We recently published a paper about something related to lymphedema. I'm not sure if you're aware what lymphedema is. Basically, it's swelling of the limb, either the arm or the leg, due to blockage of the lymph nodes. Now, there are a lot of papers relating to lymphedema for cancer patients. So everybody in the West has published it. Right? They operate on patient, usually breast cancer, and the patient gets edema of the arm. And there's a lot of work on how to manage these. In India, lymphedema occurs mostly in the legs due to filaria. What is true of these cancer patients is certainly not true of filaria. These cancer patients will die, are older, and they will die in a few years. Filaria patients are younger generally, and they will live for a long, long time. What applies here is totally different. So we have published a research saying that there's a geographical variation, and there's a reason for us to do this work. The reason that what is true for location A does not apply to location B. Therefore, do it. Or, of course, you look at some area of medicine that nobody seems to be working on, and you can say, okay, we can do a study on that particular aspect. All right. So this is the way to get an idea for research, but this is not the way to get an idea for research We have a machine, let's do it. Note that these people who are doing it the wrong way are not starting with a question. They are not starting with a disagreement. They're just saying, let's do it on this topic. You should start with a question. Okay. Now the next part. Once you've got an idea for the research, you have to, and you have finished the literature review. You got an idea for the research, you finished the literature review, you have to now design your study. So at this point, I'm going to stop sharing again and just uh, ask you. I mean, maybe I need to rush through this a little fast. That you are all aware of the types of studies, right? What is a what is a what is an experimental study? What is an observational study? What is a case report? What's a cohort study? Paramita, are you aware or would you like this covered?
Sir, well, I have gone through the studies, not in much detail, during the certificate course. It was my study was an observational study, actually, the thesis, the paper that I was to prepare. So a prospective one, actually.
But you know what exactly what they mean. What's a cohort study?
Yes, sir.
What's experimental, quasi-experimental? You're fully aware?
I will not say fully aware, but yes, sir, more or less the meanings are clear to me.
All right, okay. Let me see if maybe I'll go through it fast. Aditi, are you fully aware of the meanings of all these terms? Case study, case control study, like you know exactly what a case control study is?
I don't have a very deep knowledge of these terms.
All right. What I will do is then go through it. It's not very long anyway. I think it may be worth going through the studies. So again, briefly I'll talk, then I'll show you my slide. That there are two ways of doing studies: by seeing what is happening or making something happen. You see what is happening and analyze it. That is observational study. Something is already happening on its own. I'm not doing anything to make it happen. On the other hand, you can make things happen and then say, okay, now I'll analyze the data. When you're seeing something happening and record the data, that's an observational study. You are not guiding the way the results go. The results are going on their own without your guidance. And you're going to analyze the data. That's observational. But the one that really gives you the answer is when you make things happen. For example, some people might be giving in this particular uh, hospital, they might be giving sulfasalazine for ulcerative colitis. That hospital, they are always giving steroid for ulcerative colitis. You wonder which is better. You say, okay, you tell me your results, you'll find it. But you are not creating the results. On the other hand, you might say, okay, we are going to study it. I tell you what, you people will take sulfasalazine, you people will take steroids. Now we'll see the results. Now what is happening is you are directing who is going to which group. You're comparing two groups and you are the one who is creating the groups. When you create the groups, that is experimental. When the groups are already created because of natural reasons, that's observational. One important thing to remember in research is observational studies show association. They don't show causation. Observational studies show association. They don't show causation. I'll give you a classical example. Years and years ago, Ronald Ross. Does anyone remember the name Ronald Ross? You young people don't do too much history. But my days it was so important. Anyone remember what Ronald Ross did?
So Red Cross.
Sorry?
Red Cross.
No. Ronald Ross worked on malaria.
Yes, sir. Sorry, sir. Forgot. Yes, sir.
So Ross worked on malaria. What he found was actually, Ross, of course, found the mosquitoes. But before that, what used to happen was they used to find that wherever places are dirty, contaminated, smelly, the air is bad, people get malaria. Places which are clean, spick and span, they don't get malaria. So they used to think it's because of mal air, bad air. Now, certainly, absolutely, there is an association between bad air and malaria. But the bad air is not causing the malaria. The bad air is causing the mosquitoes. And mosquitoes are developing, not even the bad air are causing mosquitoes. The environment which is bad that's where the mosquitoes are proliferating. And they are the ones that are causing it. The bad air is not causing it. But there's certainly an association. So mathematically, the association will be there. And the best example that I can give is that you will find there is a data which shows when the birds, data from Canada, uh, Priyanka, you're from Canada, right?
No, sir.
The
I'm from
Nandita,
India.
yeah, Nankit
Aditi,
and
sorry,
me are
I'm so sorry. I'll get that sorted out in the next one or two turns. So, Aditi, this is data from Canada. When the birds fly home for winter, the crime rate goes down. It's been shown again and again.
And
Right.
why is that?
Well, there's an
I don't
association.
understand.
Well,
Yeah,
it's
I
a
don't
fact.
understand the association.
It's a fact. So you say, is it the birds? What happens? The thieves and all, they look at, okay, the birds are not there to watch, then we will commit the crime. Is that the reason? But the real reason is when it is cold, the birds fly there, and when it is very cold, the thieves stay home. Does that make sense, Aditi?
But in that case, sir, Canada will have no crime for at least 7 or 8 months because there's always snow.
All right. So this is of course a cooked up example, or maybe it may even be real. But all I'm saying is that this one highlights the fact that association, observational studies show association, and association is not causation. This is something extraordinarily important to remember, not just when you're doing like health related research, but in life. You find two things associated and all that. That doesn't mean A is causing B. Okay. Now, on the other hand, the manipulated conditions, like when you do a trial, when you do an experimental study, you're creating the situation. All right, you are going to group A, you're going to group B. Like I want to check whether smoking causes lung cancer. All right, you people are going to smoke heavily for the next 5 years. You people will not smoke. But this guy says, I don't want to smoke. Then go out of the study. This guy says that I do want to smoke. I want to be in the smoking group. Go out of the study. Because if I allow people to choose the groups, my results will be wrong. Sounds very funny. I want to tell these 100 people to smoke, these 100 people to not smoke. I will create the groups. But if I allow people to choose their groups, my results will be wrong. Can anyone tell me why? Actually, not that difficult. Anyone? Mona Lisa?
No, sir. Sorry. I don't know.
Think of this. Think of it this way.
Okay.
I have a genetic tendency towards lung cancer,
Okay.
and my genes, like that chromosome,
Hmm.
has a few genes. One of the genes predisposes me to lung cancer, and the other gene
Hmm.
makes me want to smoke. Which are the two genes are sitting side by side? So I, who am already going to develop lung cancer, will want to be in the lung cancer group, in the smoking group.
Yes. Yes.
And you will think that I am getting lung cancer because I'm smoking, but it's actually because the other.
Smoking.
You
Yes.
get it?
Yes.
That is why it is very important that in a particular experiment, the group should be decided by the experimenter, the researcher. You cannot allow people to choose their own groups, because if they choose their own groups, then it may be due to other factors, right?
Mm.
For example, I want to do a study saying that students who attend classes get more marks. So I'm comparing these people attend classes and they are getting 90%. These people have a low attendance, they're getting 80%. Or I do a correlation analysis, hours of work versus this thing. I'm only showing association, not causation. You cannot say that it is because of the classes of attendance that the person getting more. Maybe the people who are more intelligent just want to attend classes more. Maybe people who are less intelligent don't want to attend classes. Then the ones who are more intelligent anyway are going to get more marks. Does that make sense, Nikita?
Yes.
Yes,
Yes,
sir.
sir.
Yeah.
Just remember, in an observation study, you show association, not causation. The whole purpose of an experiment, the whole purpose of a trial is to establish causation. I will tell you, you people are going to attend classes 100%, you people will attend classes 50%. Then we will see your marks. That will be causation then. So, that is what makes an experimental study. Now, when you're doing these observational studies, see, experiments are always prospective. You cannot have a retrospective. No? When you're creating the groups, after that, they will have the groups. So, experiments, trials are always prospective. You cannot have a retrospective trial by definition. But what about observational studies? Well, one is what we call a cross-sectional study. A cross-sectional study simply means you have collected the data from, you have visited the subject of the study one time. At one time, you've collected data. I'm not saying you visit all the people. So you want to check, do you smoke? Yes. Do you have lung cancer? No. Do you smoke? Yes. Do you have lung cancer? Yes. Do you smoke? Yes. Do you have lung cancer? No. That sort of stuff. You don't have to see all 1,000 people on one day, but you will meet this person one time. You'll meet this person one time. You'll meet this person one time. You will not go to them again and again. One time meeting, one time collection of the data. You find out the data at a given time for that particular subject. That is a cross-sectional study. In a cohort study, you say, I'm going to collect the data today and I will collect the data again later. For example, I'm collecting the data today. You're smoking? Okay. Do you have lung cancer? No. I've established that today you don't have lung cancer. I will meet you after 10 years. That is a cohort. A cohort is a group of people moving forward. It's a Roman term actually. When the soldiers used to march, that marching group was a cohort. These soldiers are marching forward. So that's where the idea comes from. A cohort is a group of individuals followed up from this time to this time. At this time, you don't have cancer and you're a smoker. I'm going to follow you up for some time and then see what happens to you. You have to collect data on at least 2 occasions, maybe more. I can see at 1 year, at 2 years, 3 years, 4 years, 5 years.